Good morning, everybody, and welcome to this session on empowering young global health leadership here at the World Health Summit online and also in Berlin. Today, we have a presentation on an IAP project. IAP is the Inter-Academy Partnership, and a project that's been going on for 10 years now to provide leadership training for what we call Young Physician Leaders, YPL. As we get the screen up, I'll just give you a quick presentation on IAP and the YPL. We should see it there, yes. So this is, as you see, subtitled, The Leadership We Want in Our Health Systems Worldwide. So IAP itself is the global network of academies of science, medicine, and engineering. We have 149 members around the world. These are academies, like I say, of science, of academies of medicine, and one academy of engineering. We function through 4 regional networks for the Americas, for Europe, for the Africa region, and the Asia Pacific. We estimate that these academies bring together at least 30,000 leading scientists, engineers, and health professionals in over 100 countries. We have the next slide, please. So as I said, one of our ongoing projects over the last 10 years is this Young Physician Leaders Project. We now have more than 200 alumni who have all undertaken a leadership training workshop in Berlin or in some of the regional World Health Summit events around the world. So the project itself is funded by the TIDES Foundation and is run in conjunction with ESMT, the European School of Management and Technology in Berlin. And you can see there in the pictures, Joe Buford, who's a project leader from IAP, and Nora Grasselli from ESMT Berlin, the 2 main facilitators. They apologize for not being able to be with us this morning, but you've got me. I should introduce myself, actually. My name is Peter McGrath. I'm the coordinator of IAP based in Trieste in Italy. So next. So, and just to flag up that we have been ranked, this particular program has been ranked #1 amongst the top executive courses in healthcare by executivecourses.com. So we're very pleased to, with that recognition. We have the next slide, please. And just to say, usually we would meet in Berlin in person. We did do a selection process for a 2021 cohort. And we have some we've selected 24 great people. We've met many of them in a meet and greet a couple of weeks ago, but unfortunately we were not able to organize, given the global nature of these groups, not able to organize an in-person meeting in Berlin, and hence we're meeting online here. And usually we challenge this cohort, even though they just meet together a few days before the World Health Summit, to design and present this annual session. But this time we figured if there's no in-person meeting, that would be a tough call. So we've invited instead a group of alumni to prepare the session for you. And you can see their names there: Biljana Gjoneska, Dipendra Khatiwada, Jaifred Lopez, Atiya Mosam, and Juan Núñez-Enríquez. So they'll be presenting to you as we move on through this morning. Next one, I think. So here is the 2021 cohort. I hope most of them are able also to join us remotely this morning. We look forward to interacting with you in person in June. I think we're planning already for that. But with that, let me hand over to Biljana Gjoneska. She's there in North Macedonia, and she'll take you forward from here.
Thank you, Peter. And it's really big pleasure to be introduced by one of the masterminds behind Inter-Academy Partnership, one of our big supporters of this very important initiative. As you know, this year we are marking a 10-year jubilee, so it's kind of a very important milestone for us. And I'm one of the presenters on behalf of the YPL Alumni Steering Committee. And today you will have the opportunity to meet most of us. So I hope you will really enjoy. Giovanni, you can proceed to the next slide. In the beginning, I will start with just providing some overview on the YPL program. So it's just to have a kind of a wholesome perspective, integral view on the geographical representation. So these are the figures that I extracted directly from the YPL directory in order to show you how many people from how many countries and regions have been participating thus far in this program. And as you can see, the groups are very diverse. And in fact, they are kind of very much corresponding to the population representation in these world regions. So most of them come from Asia and Africa, then followed by Europe. Maybe North America is not so much represented, but we are very happy that countries that are not white, industrialized, rich, and educated and developed are equally represented within our program. We are very happy to produce, to have inclusivity in our groups. So each region is kind of, the organizers, electors are kind of mindful to be presented. Giovanni, you can proceed with the figures. So now you can have the opportunity to see in which specialty, what are the areas of expertise mostly covered by people that are deciding to apply for this program and are being selected. First of all, let me say that male to female ratio is a bit more on the side of the males, which is kind of also intuitive nowadays because leaders are still traditionally recognized as males, even though whenever a call is released, inter-academy partnership is always mindful to say that females are particularly encouraged to apply for this position. And as regards their areas of specialty, most of them quite naturally come from the clinical practice domain, many of them in the internal medicine, specializing in cardiology, neurology, endocrinology, but I would also point out to the public health domain. It's kind of very much represented. Those are people that are often public spokesmen, raising public awareness on many important issues. And even in the internal medicine domain, I mean, in the clinical science domain, there are a lot of people that are doing their specialties in infectious diseases and also mindful of about the mental health, so also psychiatry. So practically people that are working for the greater good of the society. And at the end, Giovanni, we can proceed to just briefly outline the milestones of this program. I mean, this is a very brief selection. I hope Atiya will have more time to speak about the social impact of the Young Physician Leadership Program. But I would just briefly mention that we are active in many domains. So it's not only networking, we are also active in research, in producing publications. Most of them are communications and correspondence articles on the importance of nurturing the young physician, young leadership among medical professionals, emerging medical scholars. And I mean, also we have marked this 10-year jubilee and we have several activities launched on behalf of the Alumni Steering Committee. So, I mean, Giovanni, you can proceed to the next slide. You will have the opportunity to hear more in details about our activities probably by Atiya. So I will just briefly mention that our committee is composed of people that practically come from the first and last generation. I mean, not the last, very last 2021, it's 2019 generation of young physician leadership candidates. And they literally come from all corners of the world. So it's Africa, Europe, South America, so Asia. So it's really diverse group, and it's a very interesting experience to be organizing different activities with this group. So, and you will have an exclusive opportunity to hear from us today. So I'm really looking forward to also to the presentation by other speakers. Giovanni, so now we can proceed to the, so today we decided to present different areas of action. So areas where young physician leadership has had their impact on us. And I will be presenting on behalf of research and science because, as I mentioned, I didn't, it was mentioned on the slide, but I didn't introduce myself, sorry. I am a research associate at the Macedonian Academy of Sciences and Arts. So I work exclusively in research in neuroscientific domain. And so I was assigned this role, but also my talk will be based upon some activities that were conducted together with the young physician leaders and with some representatives from other global young academies with whom we kind of understood that there are, in today's society, the concept of Renaissance men and women is not outdated, it's very much popular. So the modern polymaths of today, people that are multi-talented, especially very much talented in multidisciplinary networking and learning, are the ones that are going to be leaders in science. So, and this was released in a booklet that was also published by Inter-Academy Panel, but we can speak about that during the Q&A. And the people that are going to be leaders in science are, should be especially advanced in communicating science. So they should be communicator scientists, the ones that are going to bridge the gap between science and society, which is very important today during the current pandemic when the misinformation and disinformation, as we know, present the arch enemy, the enemy number one against vaccine hesitancy. Also, we should be mindful scientists to increase the inclusivity, to bridge the gap between underrepresented groups and minorities, and to in order for science to reflect all the diversity in the world, we should be also reflective scientists. So we should be mindful about ourselves, our self-development, constantly invest in us, but also inspiring scientists. So we should be also mindful about the others to inspire all the others. On top of that, we should be also entrepreneur scientists. So the ones that are always securing funding for the research, which is very highly valued by our superiors. And also we should be collective science leaders as well. So the ones that present nodes in this worldwide web of scientists. And this is why YPL is very beautiful. And Giovanni, you can proceed to my last slide, because it's the one organization in my life and the most important organization that taught me the lesson of networking. It all started with the YPL mentoring program. It was a program that was released at the beginning, where senior academicians were acting on behalf of as mentors. And this is where I met my mentor that kind of helped me to then apply for PhD in Italy. And then it all started from there. The other lesson that I learned is about the networking, as I mentioned, with many different scientists from different regions. And this is a practice that I also nurture within YPL, but also in my everyday practice, where I am kind of a leader of my national research group within multinational studies and projects. But I hope I can speak in very great detail and length about this later on during the session. This is a very brief overview. And I think it's safe to say that I can conclude this presentation for the time being. As I'm saying, I'm available for you to the Q&A. And I hand over now to Jim, I suppose. Yes.
Thank you so much, Biljana. So welcome to our session, and we thank you for joining us. So my name is Jaifred Christian Lopez. You can call me Jim. I go by Jim. I'm an assistant professor and special assistant to the dean at the College of Public Health, University of the Philippines. And I think another aspect of leadership that we would also want to emphasize in this session is how we are also leading in the field of education. I mean, Biljana mentioned a while ago about the fact that a lot of young physician leaders are also engaged in spearheading a lot of educational initiatives, and I have the privilege of having been able to participate in these efforts in the past few years. So I think you will agree that educational institutions are really thrust at a particular juncture at this time. I mean, it's a very difficult thing, a very difficult responsibility to be part of the educational sector at this time, since we usually do a lot of research, teaching, service, and we are used to doing that in person. But because of the current pandemic, there has been a lot of changes with that, and we had to really adjust. So teaching was the first one to go. I mean, the in-person teaching, it had to really adapt to a particular mode where you can do Zoom teaching, or for those who are familiar with Canvas or Schoology or Google Classroom. So those kinds of initiatives, but also it adversely impacted research and survey, since these are things that are really done in person, especially for those who are doing the laboratory kinds of research. I think service will also be affected as well, since a lot of the public health interventions that we do are dependent on in-person interaction. So we noted that in doing all of these adjustments, there have been 4 challenges that have been documented by a recently published study, that a lot of the things that are affecting our institutions at the moment, and the leadership as well, would be the importance of improving crisis preparedness. There's also concern on the quality of remote learning. Of course, it really begs the question of are you really able to transmit the quality of teaching that you are normally able to do in an in-person setting, rather than to do it via Zoom? So of course, that's a kind of question that is really gaining importance at this time. Of course, financial reasons, since a lot of our students are dependent on parents and family members who have lost livelihoods. Of course, so we also hold them in our thoughts at the moment, as well as online delivery. So especially since online delivery will be a bit of a barrier for a lot of people from lower socioeconomic levels, where they won't be able to access steady internet or devices to access their education. So the thing that the key direction that we are being led towards is digital resilience. So how we are able to do these things, while at the same time realizing that innovation is still possible, and there are a lot of key leadership values that are being exemplified by the current journeys that we are undertaking. So we hope that we'll be able to exemplify equity, shared leadership, trust building, transparency, and clear communication. So these are the things that were put to the test in the past year and a half that we have been implementing these educational strategies amid the pandemic. Next slide, please. So I'd like to just walk you through some of the things that we were able to do, and I'd also would like to glean some lessons. Next slide, please, Giovanni. Hello? Next slide. All right. So I was about to emphasize the number of the efforts that we were able to undertake that required a lot of leadership agility. You may be familiar with the concept of a volatile, uncertain, VOCA, I forget the C, ambiguous, right, world that allows us to put into words the confusion that we have been subject to since the pandemic started. And of course, that required a lot of soul searching, a lot of strategizing. But of course, it allowed us to develop strategies that would allow us to continue accomplishing our objectives as an institution. So we were challenged to deliver our courses in hybrid ways, building peer learning strategies, as well as also transmitting things through online. Of course, we needed to navigate uncertainty and to bridge challenges, especially across sectors of our student population who may have difficulties accessing the necessary materials for learning. And of course, I think this is something that will really emphasize the leadership aspect of it all, that we needed to strengthen community spirit, since it's not really just an issue that pertains to our work. It was really also something of an emotional aspect that we needed to handle. I mean, people were dying, people were getting sick. So of course, we needed to take care of people. So this is also where the leadership aspect of it comes in, that we needed to get ready with our emotions. We needed to exemplify a certain sense of maturity, of being ready for the occasion. And it's basically helping us in terms of being ready to engage with others, with stakeholders, community, and partner agencies. All right, so that will be all. And I think I'm very happy to introduce our next speaker. I hope I assume he's here already. Am I correct?
Unfortunately, Jim, it seems like Dipendra is not able to join us today. We know he is very busy with the response in Nepal. So I assume he has been taken away elsewhere. So I think we're going to skip the next 2 slides and we're going to move on to Juan Carlos, our colleague from Mexico. If I could just ask our support team, I see Juan is in the actual general attendee list under Graciela Castañadas. If you can please give him speaker privileges so that he is able to present his slides. Thank you, Jim, and over to you, Juan Carlos.
Maybe I can just jump in for a second while we're waiting for Juan Carlos to be admitted. And to remind everyone, if they do have questions for the team here today, please put them in the Q&A. But I have one for you, Jim. You raised the issue there, a leadership challenge of crisis preparedness. Can you ever be 100% prepared for a crisis? It's obviously a crisis because you don't know what's coming. Well, how do you get as close as possible? Are there sort of leadership actions you can take to be as prepared as possible?
That is a good question. I think we had some difficult experiences along the way, but I think I was reading up on how to handle VUCA situations, and one of the things that were emphasized in that reading was the concept of incrementalism. I mean, you have a very big problem, and I think one thing that would be very useful is to break it up into parts and to take it one at a time. Since of course we're but human, we can't really solve the whole problem all at once. So I think it's really breaking it down to manageable parts. And I guess it's also being forgiving of yourself if there are things that don't seem to really get solved right away. So yeah, those things were very helpful.
Okay, thank you.
Information of the technical support, Graciela has to accept the invitation from the host.
All right, thank you so much. I think maybe while we are waiting for that, should I jump into my presentation? Giovanni, if you can maybe stop share for a second. Thank you. So hi, everyone. My name is Atiya Mosam. I am a public health medicine physician from South Africa, and I am part of this lovely committee who works together quite seamlessly to try and to try and bring about alumni activities for the YPL alumni. And my reflections today is around social impact. So the reason why I don't have a presentation for you is really because in our discussions, we were talking around how to make leadership and some of the challenges very granular and close to home. And so I'm going to reflect a lot on my experience in sort of the social realm of leadership in the past 2 years and give you some of the lessons that I have learned. So a former teacher and colleague of mine, Professor Shan Naidu, says that public health is a discipline where you inherit a constituency that did not vote for you. So these are the poor, the sick, the disabled, the aged, the voiceless, and our job is really to transform our country and the continent that we work on through our work. Now, I think you'll agree with me that those words have never been truer than in 2020. And my years of clinical and public health and social advocacy experience really all kind of collided in an effort to contribute to the COVID-19 response. So as a physician working in public health research and consultancy, I really had no formal place in the health sector response to COVID-19. But as a public health physician in a country which most of you will know is deemed the most inequitous in the world, I was acutely aware, as were many of my colleagues, of the potential of this pandemic and the subsequent response to actually widen these inequities faced by my fellow South Africans. And so that's where my journey to contribute, where possible, to South Africa's response to a potentially devastating pandemic began. So 9 days after our first reported case, my public health physician colleagues and I began petitioning government to institute a lockdown to allow our already overstretched health system, as is the context in many countries, to ready itself for potential onslaught of cases. And this call to action was the basis upon which a group called Public Health Action was formed. This is a group of public health physicians who've mobilized for social solidarity and health equity. And this initial petition led way to more advocacy efforts, and most notably, we engaged with the WHO to amend their mask policy to include the extensive utilization of face masks. As you may note, in the early stages of the pandemic, masks, for many reasons, including supply chain, were really advocated for healthcare worker use alone. However, once lockdown was instituted, the work was actually just beginning. In my sort of clinical and public health medicine realm, advocacy took the form of engaging with multitudes of stakeholders and citizens to sort of temper the panic that was being felt, but also ensure access to consistent and reliable information. And this included not only sort of formal engagements with the media, but also advisory consultations to provide public health expertise and health system readiness advice to sort of religious bodies, sporting organizations, medical associations, and even individual medical colleagues. It also led to the development of COVID-19 related content in local languages for easy dissemination via social media. South Africa has 11 official languages, and so getting information to our entire populace is quite a task. Of course, this had to include links to sort of verified sources, such as our National Department of Health and the World Health Organization. But I think the most important through all of this was this urgent need for social advocacy and solidarity, which led to activities whereby volunteers were mobilized in both the health sector and the general populace. So the first group that I started formulating consisted of individuals with healthcare experience who were either retired or sort of suboptimally employed due to either redirection or closure of the health services that they are usually engaged in, and therefore were looking for COVID-19 related activities to support. The latter group of volunteers led to something called Community Connect. This nationwide platform was constituted of citizens who used various technologies such as mobile banking, online vouchers, and messaging apps to provide social assistance where needed. And this was remarkable because it provided people in Cape Town, which is about 1,000 kilometers away, to individuals in Johannesburg, for example. And the platform sought to connect these individuals and households in need with people and communities who were willing to assist them no matter the geography. So this took place in the form of food parcels, of grocery vouchers, cash transfers, and really allowed us to provide food and electricity and other necessities. And if you know South Africa, you'll know that this was a critical need in a country where so many citizens were either below or teetering on the edge of the poverty line, even prior to the pandemic. So I sat back as I was writing this and I thought, what are some of the lessons that I have to share about my past 18 months? And the first is, and Jim alluded to this earlier around advocacy, it's a reinforcement of a message that I tell my undergraduate medical students when I see them sort of struggling with the application of public health principles to their individual interests and careers. And the lesson there is that advocacy and medicine are so inextricably linked. I know, thoughts of advocacy naturally default to us picketing and petitioning and mass movements, especially in a country like mine. But it really is that sort of everyday advocacy that's necessary. The sort of advocacy that happens when you apply for social assistance for a patient, or when you gently guide a colleague whose bedside manner or general manner has caused maybe a patient or another colleague discomfort, or when you find a way to alleviate financial burden of healthcare on those who cannot afford it. And I know whilst, as physicians, by virtue of social dynamics, we are seen as leaders by default, there's still hierarchies in medicine that may constrain this leadership potential. But I see patient advocacy as, by its very nature, an example of leading from where you are, but also sometimes leading beyond your formal authority and your formal title. In relation to all of this, the second learning that I have is that no matter the prestige afforded to you through your recognized leadership potential, no opportunity is worth your mental health. Again, my colleagues have alluded to this, and sometimes the allure and the excitement of recognition can result in us saying yes when we actually should be saying no. And one of the biggest challenges for a leader is learning, and this is the lesson that I learned this year, that just because you can do something does not mean you should. I learned the lesson when I was asked to take on chairing a really important academic event for the university that I work in. And I found myself stretched in such a multitude of ways and in real danger of burnout as a result of juggling this voluntary work while making allowances for a mentally depleted team and acknowledging their mental state, and then still attempting to meet my work-related deliverables. And so I really learned a lesson about, that was one of the many times that I learned a lesson over the past 18 months about not everything is my battle to fight and not everything is for me to do. And then finally, leadership can be a lonely and anxiety-ridden journey, and it's well worth the time taken to cultivate a tribe to support you, to guide you, and sometimes just catch you when you inevitably fall. I mean, this could include mentors who've walked the journey ahead of you, peers like my colleagues here today who are walking beside me, and if you are lucky, junior colleagues who aspire to your path and can offer a fresh perspective. I think I still maintain that the one positive aspect of COVID-19 has been the real spotlight it has shown on mental health, especially for healthcare workers. And I think for the first time in my relatively short medical career, it was not only accepted, but outright encouraged to take into account the mental health of our colleagues. And I think that leadership with empathy needs to be the norm, and it's up to us to continue in this manner. So in closing, I think leadership is a deeply personal journey. Physicians are expected to be leaders in so many facets of our lives, both personal and professional. And platforms like the YPL and the associated network of colleagues who face similar challenges allow us not only to undertake formal training in the art of leadership, it's a skill, it is an art, but also allow us for peer engagement along the road that we have ahead of us, and hopefully it is a long road. And with that, I thank you. Over to you, Peter.
Okay, thank you very much, Atiya. And I do see one or two questions appearing in the chat. Maybe they've been answered sort of at a one-to-one level, but
No.
no. Okay. So
We saved them for the Q&A session.
Sorry, Biljana?
We saved them for the Q&A session. I mean, for whenever we are ready for discussion. I just mentioned that I would, and probably also Jim would be very delighted to answer them in live while discussing.
Well, I was wondering if we should move to that session now, because our other speakers have not shown up. Dipendra, of course, we've already said was very busy with the response that's just getting off the ground really in Nepal. So let us go, because I see some of the questions are coming in also from our 2021 cohort. There's one that's appeared for you, Atiya. I completely resonate with your views and thoughts. Quote of the session: leadership is a deeply personal journey. So thank you. That's from Pradeep Kumar. I wanted to touch on, before we sort of dive into the questions that have come in, Atiya, you mentioned leadership with empathy. And I think it was Jim that you talked a lot about sort of trust building and shared leadership. I wonder if there are sort of overlaps in those concepts that we can maybe sort of tease out a little bit.
Yeah, I don't know if Jim wants to go first.
Yeah, so I actually was connecting it with our theme from the YPL World Health Summit session that we had when Atiya and I were part of the cohort. Since we also had something like this back in 2019 when we had this in person, and the lesson was, or the theme that we had was, leadership is diversity. I mean, leadership is built on being able to identify oneself within a diverse group of people, being able to work with a lot of people. I think a lot of that touches on being able to build trust. Since, of course, if you have a lot of people from different backgrounds working with you, of course, you will have to trust people around you, and they also have to trust you as well. So I think that's one thing. But another aspect that I also discovered as I was also reflecting on that theme was the fact that trust isn't really something that's automatic. You have to really go through it. It's a journey. That's why I also recognize that it's also something personal. So there are also times in which, if ever you are coming from a particular society or particular background where people aren't really given too much opportunity to speak out, for example. So of course, there will be some remnants of that, and I think personally, I had to hurdle those kinds of personal biases or personal difficulties. So that was a journey in itself. So I would say, for that reason, there are intersections, and I'm happy that this session emphasized those things. Atiya, I think you have other things to say as well.
Thank you. Yes, I have very similar reflections. I think for me personally, I find it very empathetic, for example, to see how the struggle of people like my patients, or people who have disadvantaged backgrounds. Where I do struggle with empathy is when I feel like someone is like me and should be performing the way I should be performing. And so this comes down to colleagues, for example. We think, oh, but we all have access to the same internet and we all have the same struggles. And that is where some of the time my failings in empathy happen. And I recall quite strongly in our 2019 cohort when we were deciding, when we were planning for actually this session. And in South Africa, inclusion and diversity is really top of the agenda. And in anything that we do, we ensure representation. And I remember having a very robust debate with another female colleague, because I felt that we needed a gender balance so that, to ensure representation. And in her mind, she felt that just because we are female doesn't mean we have the right to be on the panel. And that it was tokenism and not merit-based. And it was a very interesting, for me, view, because I always assumed that people have similar worldviews in some of these in these aspects, because coming from the country that I do. And so, I think those type of engagements really allow for, as Jim says, that the empathy for you to learn more around how people think, and therefore you are able to more easily see things from their viewpoint and not just assume that yours is the correct viewpoint. So yes, it's a lot of, I think, engaging, and as you say, Peter, trust building and being able to be real and open with people and share your views and why you think certain things.
Okay, thank you, Atiya. And I see we're joined by Suraj Bhattarai, also from Nepal. So maybe Suraj, welcome. And if any of these questions resonate with you, I don't know if you want to follow up on anything on this one, but feel free to jump in. But for the moment, let us move back to one of the answers. And this is from Jean and Sia. I've just looked her up. She's one of our 2021 cohorts. She's based in Ghana, an occupational medicine practitioner. And she had a special question for Biljana, which was, what was the most significant change to your approach to research or practice after your YPL experience? I think you said you go back to the 2011 cohort, so we're going back a few years.
Traveling in time, yeah. Yes, I would be delighted to answer this. I mean, it's a very important question, even though it's kind of broad and even philosophical to reflect on one's life, in this case mine. But I must say that the first change was discovering that I need to work with as diverse people as possible. And this was directly, inspired by YPL in 2011, but also other cohorts with which I had contact, because this group of people is really diverse. I'm just here to suggest to interact as much as possible. I already told you that the people are coming from many different regions, but this diversity is only superficial. This is formal diversity, if you think about it. The diversity in YPL is even more than skin deep, as they say, because these people are really diverse within their careers. So for example, I met people, I'm really proud that I run half marathons, for example, but I met people that are running ultra marathon. So I also really like writing poems and prose, and I met people that are really famous writers. So, and at the same time being physicians. So these are people that are high achievers and motivated to be leaders. And one of them, actually coming from my country, became a minister of health after becoming a YPL candidate. So nurture diversity also in research for me was one of the big changes that I implemented in my life. So the crucial thing that happened for me, I went to Italy because I met my YPL mentor. He is Giulio Stefanini from the Accademia dei Lincei, and he inspired me to go to Italy. So then I went to Italy to do my PhD, but the crucial change for me, for example, was the decision to come back to my country, North Macedonia, but then remain active in interacting with people from the world. So now I represent my country in many multinational studies and projects. And those studies and projects really have important outcomes. Some of them are published in Nature Communications, Nature Behaviors, Human Behavior. Some of them are in the process of publishing in proceedings of National Academy of Sciences. So this was the most important change in my life, realizing that I need to continue nurturing this type of relationships. These people are really important, and the people that you are going to meet, not maybe today because the format is limited, but as far as I know, maybe Peter can correct me, you are supposed to meet it live in person also in June or July. So I am really advocating for you meeting in person and interacting in person. And thanks again for this very, very beautiful question.
I see Suraj has disappeared off our screen, but as you, Suraj, probably the next in line, I think the 2016 cohort. So that's 5 years ago now. I wonder if you had any additional comments. And then Jim, did you want to say something? I saw you waving.
Yeah, I'll allow Suraj first. Yes.
Okay, thank you, Peter, and thank you everyone for allowing me to speak. So yeah, I think the leadership approach has been changed after I attended the YPL session 2016. I got a chance to work with experts from, I mean, all age groups, and then it gives me a chance to not only learn from them, but also to communicate with them, like, and also to collaborate in different interdisciplinary projects. So the leadership approach for in research projects is not only managing the project from a technical side, but also from the financial perspective, also from team management, sense of leadership that I learned from.
I think we're losing, Suraj. So let us move on to Jim. The connection wasn't so good there. But Jim, go ahead.
Yeah. Yes. So that's an interesting question, since I think there is some thinking there that the YPL is something like something that transforms you into a leader. You're now a leader. I mean, I'm not sure if that's the case, since I think people are being chosen into the program already having this kind of leadership potential. Of course, I'm a bit modest since I'm still learning to be a leader, to be honest. But I think another thing that I learned from the experience is the fact that people are actually having more expectations of you coming out of the program. And I remember it quite distinctly when I returned from Berlin in 2019, and I was able to report to my supervisor and tell him, hey, I've already finished this program. Then he told me, I'll be giving you a lot more responsibility, since the program should have taught you a lot of things about leadership. And I think it's more of building up that kind of arsenal of being a good leader. I think Biljana also touched on the networking aspect of it, since one thing that we learned from the YPL was to really draw strength from our peers who are in very similar situations. I mean, we are rising leaders in our own right. So it's nice to have some people who are in a similar journey as yours, that you are able to interact with them and share your challenges and struggles. But of course, to share joys and simple ones at that. So we have, for example, our cohort as a WhatsApp group. So we tend to get in touch with one another. The Alumni Steering Committee is another thing very recent that I was able to derive strength from. So yeah, so YPL, in a sense, it's not just really for the things that you learn from it, but it's more of the skills that you gain from it, the networking, and of course the people that you meet along the way.
Yeah, and I think you hit on a very important point there, Jim, about drawing strength from your peers. I mean, you were sort of almost instantly dropped into a group of at least 24, 25 that are in your particular cohort, but also the wider network of the more than 200 YPL that we do have now. So let's move on to the next question. We have one from Alejandra Paniagua Avila, and she is from Guatemala. She's a GP and a doctoral candidate in public health, currently, I understand, based in New York. She's one of our 2021 cohorts as well. And it's a topic that's been touched on a little bit already here. And she says she's been thinking about it a lot. Jim, you just mentioned, or tangentially a little bit, about getting extra workloads, perhaps extra thing when you come back from the course. So the question is, once you become recognized as a leader, there's more and more opportunities to get involved in projects, initiatives, etc. How do you go about prioritizing if you want to get involved or not in some of these projects? How do you make sure you balance your leadership activities with the rest of your life, the family, your health, your finances, and avoid burnout? So work balances and work-life balances. Anybody want to go first? Atiya?
Yeah, probably.
Okay. Thanks, Jim. So I know this is probably going to sound very, and since we are all very medical, and this is going to sound around but airy-fairy. But one thing that does keep me balanced and grounded is to, at the beginning of every year or whenever it suits me, is to actually take stock of where I'm going, what I plan to do. And some people call it a vision board, but for me, it really is around what do I envision for my life, whether that is my relationship with my husband, my relationship with my family, my career goals. And having that in the back of your mind allows you to be guided as to what you should take and take on. But as I said in my presentation earlier, you still get a bit derailed sometimes because there is a real excitement by being asked to do something prestigious. And I think that is where the role of both a mentor and a peer mentor is really helpful. I've read a book recently. It is a really good book. It is called Life Design, the Stanford Life Design book, where it helps you unpack these areas and helps you think through your life holistically. And part of that book talks about something called prototype conversations with people who you maybe aspire to. So it's the book really uses it for getting job opportunities. But I have done that. I have approached people, and you will be very, very surprised the amount of senior leaders who are happy to talk through their journeys and their leadership challenges with you. And they are there also, they become a sounding board for you. There are a lot of people who would take you on as a mentee. Similarly, I have accountability partners in my peers who I can come to and say, I have this, and they would say to me, how's the rest of your plate looking? Is this something feasible? Have you taken a rest? So I think, and YPL really gives you those peers. You can find them also in your workplace. But to Jim's point, and around not just becoming a leader immediately after the YPL, it's really about practicing what you've learned. And I think using your peer network is one of those practices. We do, and hopefully this year's cohort will also undertake the peer mentorship exercise that we did, which we all found exceptionally useful, and take those exercises and practice them. Jim and I just yesterday had our own little peer mentorship discussion. And so, use those tools. I've been on many leadership programs, and you only gain from it what you practice.
Jim, yes.
Right. I think I'd also like to touch on, sorry, Peter, if I may. Right. Hello. So basically, I actually gave a preliminary response through the Q&A, and it's basically, so Atiya was talking about peer mentorship, and I think I really learned a lot about accompanying colleagues and really identifying yourself in a kind of trajectory with them. So I think that was very helpful. I also would like to look at it from a personal perspective, since going back to that theme of leadership as a personal journey. Since I also think that leadership is a very emotional journey, and along the way, when you get to particular milestones or particular difficulties, you find yourself in a certain emotional state, like you either get burned out. I think that's the question. That's what the question was acknowledging, the potential of getting burned out, or actually developing responses that might not be very healthy, especially if you are working in a team or you are in a high impact situation. People rely on you. So yeah, so basically, I would not discount the possibility that I will get into those kinds of states. So that's why whenever I go into that state, I try to distance myself from the situation for a bit, and then try to look at what triggered me. What aspects of the situation really brought out that negative emotion from me. And it's very helpful. I try to keep track of those triggers, so that whenever they come up in subsequent leadership challenges, I try to really pay attention and somehow seek help. Probably one of the things I realized in the YPL is that leadership is not something that you take on alone. You have to really have people around you, and walk through those triggers. You don't need to avoid them. You can talk through it with another person, and if needed, a professional. So that's why we're very happy that the pandemic actually, of course, we're not happy for the pandemic, but we're happy that the pandemic actually brought up these important aspects of mental health. Because if you need help, seek for it. Don't be afraid to look for it.
Thank you, Jim. Welcome, Dipendra. It's good to see you. I think we've got one question sort of waiting for us in the chat, so let's deal with that, and then we can maybe move to Dipendra's presentation. It's from Hervé Lakuya. She's another one of our 2021 cohorts, based in Uganda, and is a neurosurgeon. The question is asking about about your experience in dealing with young elder conflict of leadership. The seniors, they think they are always right, and they have challenges to accept change from the younger generation. And there's a sort of follow-up question to that from Muthoni Karete, who sort of puts a young woman in that position, and how to deal with older male and female colleagues who may not accept that. Anyone? I see Biljana, you're nodding, so maybe you can have first crack at this one.
Yes, I already mentioned that I would be happy to provide some insight from research and science perspective, especially from the perspective of Academy of Sciences that exist in many countries. And in relation to this, I would just point out to one very brilliant piece called Merit-Based Academies of the 21st Century, published by the IAP. I mean, in this piece, they are talking about the academies, traditional model of academies, those that are based on hierarchical models with vertical hierarchy, when there is a senior elder that is very undisputed authority in the field, because, you know, academicians are those that are publicly recognized by the wider society. And then there are also researchers, as I am working in this academy. And I can really relate to this question, and I can really feel like it's a personal question of sorts, because I can feel this hardships, let's say, on a daily basis. But personally, I think it's best, and also this is in response to Muthoni's question, is best to form pacts, to form sisterhoods to align with women and younger scientists. So in this regard, there are new initiatives. For example, there is a Global Young Academy of Sciences initiative that strives to create young academies within each of these senior academies in order to give voice to younger researchers. In this regard, I would just salute Suraj, who is one of the representatives of the Global Young Academy, and he will have a talk in the next session that will be provided by the Global Young Academy. So you are free to join this session. So basically, I mean, just one is maybe not strong to fight these traditional models, but when you are many, and if you seek to join this kind of unities, for example, in my academy, I established something of a support system, like a network for all the younger junior research scientists. And we are starting to meet on a monthly basis to discuss our priorities and our hardships, and then to communicate them to the president. Maybe the president will not hear one researcher, but certainly he cannot ignore many researchers. So this is my response in relation to research, in relation to academies of sciences. So it might be specific, but I hope it can give some insights for the rest of the domains.
Thank you, Biljana. Does anybody else want to have a comment or add anything on this sort of managing upwards?
Yeah, so I would like to respond to this question as well, because I think YPL is giving, IAP is giving an example, bridging the gap between the elder and younger by nominating the young physician leaders or young representatives in different committees, and sending them to different programs. I remember attending few meetings in the UK when I was studying there, then attending high-level meetings and interacting with the top-level leaders of different age groups. So, and it gave us chance to speak with them and put forward our words. So I applaud the initiatives and then the actions taken by IAP by encouraging the young leaderships and then participation in the meetings and the discussions, so that our voices are heard and not dominated by the older leaders or experts. Over.
I think there is a general consensus also coming out through the pandemic, if you like, of this diversity of voices in leadership and the sort of the equity concepts and so on that we're hearing, so that there are opportunities there for leadership at many levels. Okay, I think right now we can probably introduce or allow Dipendra to introduce himself, and I understand you have a couple of slides. We'll go back to the presentation. And again, I encourage those following us remotely to put any questions in the Q&A that you might have for Dipendra based on what he's about to present, or any of the other speakers on any of the topics we've touched on, or indeed any other leadership issues that we might not have covered yet. So Dipendra, the floor is yours.
Thank you, Peter. My apology for being a little late, because again, this is the leadership challenge we face in various contexts. And I just have a good example just now as well. So I'm Dr. Dipendra Khatiwada. I'm currently involved with World Health Organization's country office, Nepal. And I'm supporting immunization unit and the immunization cluster in the WHO Nepal. I'm currently in the central main office supporting the immunization as well as current COVID-19 vaccination campaign in Nepal. So basically here I'll be talking a little bit about leadership and the leadership challenges we have in public health, as well as a few things for our young YPL colleagues and this side. So if we go in, I have a best example now. Only I'm currently out of Kathmandu Valley supporting one of the central government program on Pfizer rollout in Nepal, and actually we are in the provincial training programs to the new stakeholders of the COVID-19 vaccine, including the health directorate, the provincial leaders, including our health professionals, even hospital doctors, and the up to vaccinator levels or health professionals. And I just was taking another session where I was talking about Pfizer rollout in Nepal, our policies, our challenges, and our strategy regarding rollout of vaccines in Nepal. So when we talk about leadership in public health, again, it is very challenging in resource constrained countries where we have limited resources, and we have to make the best of what we have. And now we are going through the pandemic phase, and this pandemic phase has really stressed our healthcare delivery system, including our various health programs, including COVID-19 vaccination, prevention and containment plans, as well as now currently what we are dealing with the COVID-19 vaccinations around the world and globally. So one aspect of leadership in public health I always emphasize is we are now moving from the one sector to multi-sector approach. Previously, we used to say health for all, and now we are moving from not health for all, but health in all. That's why the role of various sectors in health has increased. And we have to incorporate all those sectors in health. And for that, we need good multi-sectoral coordination and their involvement if we want more lasting impact in health at community level, at national level, or at global level. And for that, the current leadership in health challenges are there. Again, we've been discussing what kind of leaders will be needing in health sectors and how we did, especially the COVID-19 have taught us many lessons regarding the leadership is not only for the routine, but also the leadership in the various challenges and emergency conditions where the whole health systems can be disrupted by any health emergencies, including any kind of disease or any kind of other health disaster conditions. So we have to lead at different conditions and we have to prepare ourselves for that change in the various policy level. It may be national health policy level, it may be local context level, or at various level that is always there. And we have to be able to make the impact in the policies, in the strategies, in the delivery, and what is foremost important is its implementation. Until and unless we bring that policies into the action or going into the community level and where the people can feel the policy has really changed the life of individuals. That is very important. And that is something the leadership have always need to think about. Similarly, the leadership also has to think about the various challenges in health at different point of time, including the problem that arise in the health system. The problems may be different from the countries, from the different levels, or even at different subnational levels or at community levels. So accordingly, we have to be able to manage those kind of situations. We have to have the clear visions and strategies to sort out and deal with those kind of problems. And also the influencing, it's influencing not only the life of individual, but again, it starts from the top to bottom approach, where the policy levels are involved and the mid stakeholders are also aware about all those things. And when we finally go into the actions to solve out those kind of problems and where the interventions is intended to. So it has to be more impactful, where we can be result oriented, and all the approaches should be again based on the clear evidence, where we can bring all the stakeholders and even the people together to have the confidence on any kind of interventions we are doing in health sector. And also the leaders should be again well equipped, because it is again going through the top. There should be clear visions, the clarity on their the interventions in their policies, which can again ultimately deal with the complex health system that we are dealing with. And again, finally, I would again like to say, now health is not one person or one sector, it is multi-sector. And until and unless we bring all those people together, including the political commitments from all the stakeholders who are engaged in the programs, and ultimately those who are involved at the subnational level and community level, and the community participation. This is very important, where they accept the kind of changes that is intended and required at the individual level. So all these things has to be seen, should be carefully thought out, should be dealt, and also should be realized at different levels when we talk about leading in health system, leading in public health system, or any kind of interventions we intend to. So now the leadership challenge has more. This COVID-19 has realized the importance of why we need good leadership in health, why we need this good leadership in public health, and where our health systems will be leading in the future. That is very important. So accordingly, we have to deal and we have to go forward, incorporating all these minds together if we really intend to envision the health at various level and where we seek for more impactful health interventions at individual level. So with this note, I'd like to conclude, and I'd like again look forward for any kind of questions that are attended from our colleagues and participants. Back to you, Peter.
Okay, thank you, Dipendra. Maybe I've got one question for you. I was listening yesterday to a session of the World Health Summit, and speaking was the former Minister of Health from Colombia, and he was talking about, and the discussion was going on about the example of One Health and health in all policies that you've just touched on a little bit with your multi-sectoral approach. And he was saying basically that despite his efforts as Minister of Health, he was very good friends with the Minister of Agriculture. But when it came to the cabinet, they were sort of fighting for resources from the Treasury, and there was really not much cross-collaboration between them, even though they were good friends and so on. They were still working in silos. I mean, as young leaders potentially sort of coming up with this mentality of sort of multidisciplinary working, do you see sort of cause for optimism in sort of breaking down these barriers between ministries, between silos, and how might it be done?
Yes, thank you, Peter. Yes, well, that is what we now seek in the health system, where there is more collaborations between the various stakeholders, various agencies. Also, there should be more collaborative approach when we deal with this kind of problems or strategies, and they all should be incorporated. So that's why we seek good political commitments. The health system should be well supported by various sectors, including political commitments, including all the sectors, various stakeholders involved in the health, and also the government and the bureaucrats. This is something very important. Again, the health professionals will be always there, and they should be capacitated, and the skills should be enhanced, so that again, what we intend is the real change in the individual level and community level. This is something which has to be felt, and the people should feel the confidence on the health system. Back to you, Peter.
Would anyone else like to comment on this multidisciplinary?
Yeah, I mean, I want to give another example of, I mean, you gave example of One Health, but I want to give example of urban health as well, because urban health is a very new topic and people don't realize this is a multi-sectoral, intersectoral project. So for example, the Ministry of Urban Development are focusing on development in urban sector, not integrating health agenda into their projects. The same with the Ministry of Health, they are just focusing on health, but not integrating the urban agenda. So as well as the Ministry of Infrastructure and those things. So I think multi-sectoral engagement as brought by Dr. Dipendra is very crucial in all countries, in all topics related to health and development. Thank you.
Thank you, Suraj.
And there is one question for Dipendra, I think,
yes,
from our colleague JC Katev. I think he's from Ghana. He was my colleague in YPL 2016. So he asks, how do you go about health in all when many other sectors do not see the need? So maybe Dr. Dipendra,
yes.
Based on your COVID response, how do you find it, like whether it's challenging or easy to work with different sectors, especially health in all agenda? So what's your perception and experience?
Thank you, Suraj, and also the questions by the GN. Exactly. Now, when we talk about our programs and successful program implementations, we need to incorporate and collaborate with all the sectors. And that is again the leadership challenge. Again, if we see in the pandemic also, we have seen the role of different multidisciplinary approach or the different stakeholders, including not in the higher level at the political level. Exactly the role of different ministries, and it is not only the role of the ministries, but also bringing them together. This is something the real leadership challenge comes into, especially in the resource constrained settings. So this is where the real picture and the challenge of leadership comes into frame. That's why all these things has to be looked into. That is what we foresee in the leadership challenges, that to bring all these stakeholders together. And this is all the partners, all the stakeholders should be in one platform, should have one voice, and should unite together to deal with any kind of health challenges, and again, like in the health emergencies that we have already seen. So this is another leadership challenge that I always focus on, bringing all together. And without that, it is very difficult to go for successful implementations of any kind of policies we make at the top level. Yes, back to you, Peter.
Okay, perhaps a related question is, how do you effectively manage political interference and bureaucracy in public health sector? Especially as a young leader. Atiya, I see you have a reaction to that. That's from Gerald Musa.
Thanks, Peter. Yes, it is something very, very difficult. And I think in my presentation, I somewhat alluded to the fact that some things are not your battle to fight. So you really have to think through whether, this is in the scope of your influence, and is it worth sort of your mental and physical energy to fight. But I also have learned some lessons in, for example, trying to create a policy at a national level with various stakeholders, where you as an independent person has to hold and manage the different agendas of different stakeholders. And it is a skill that I think can only be learned through having been in that. It is not something anyone can teach you. There was nobody who could have prepared me for it. It is something that you learn, and as you engage with different stakeholders, you understand how to handle different stakeholders and different people, different sort of entities with interests or groups have different ways of thinking, and therefore they have different ways of needing to be managed, needing to be engaged with. And it really is an art that you learn as you go through your leadership journey, and how to engage with those people. But what I have learned, and I think it alludes to some of the other questions that are out there, is that as opposed to, I think, the old model of leadership, where it was very much autocratic, do as I say, the style of leadership is evolving now towards co-creation and bringing people along and ensuring that you have buy-in. And so in handling, I think there was questions around how do you handle it as a young woman, how do you handle it as just a general young person, how do you handle it in terms of bureaucracy? I think getting buy-in and co-creating with people and trying to get them along with your vision is much easier than sort of laying out the law and expecting people to go along, especially since, as we've spoken about, there is diversity of thought, there is diversity of personality, and we've learned now with the pandemic, there's even diversity in how people work in terms of different personalities. So I think that is, again, something that you need to work on consistently and hone as you go through your career.
Thank you, Atiya. Dipendra, you have something to add?
Yes, just to add to Atiya, the emotions when you are stressed in your programs, like maybe as academicians, yes, you may take time, but when we are working in the ground level, and especially when the multi-stakeholders are involved, yes, you'll be stressed beyond your capacities and also beyond your times, like we have seen in the response to COVID-19, where you'll be stressed for many hours. You'll have a lot of pressures coming from various levels, from your higher authorities and some government counterparts. So this is, again, depends on the individual, your leadership style, your dealing with this kind of situations, your communication skills, and how you work in diverse environment. This is very important if we want to be always see as a true leader envisioned within us, or even if you see for any leadership qualities. So you'll be stressed, especially in the situation of emergencies. You may have to work many hours. You have to work with various people, and you'll have the various emotional upheavals and up and down you will be going through. And again, this is also part of the skills you need as a health professional or as a health leader. This is very important. Yes, thank you.
Yeah, thank you, Dipendra. Of course, an analysis of leadership styles is part of our YPL sort of leadership training to identify them, which type you are perhaps for the majority of your time, but being able to switch between one style and another when the moment calls for it. Let's move on to another question, and again encourage sort of questions if there's people out there listening in to put their questions in the chat. This one comes from Kosala Weerakun, another of our 2021 YPL cohort based in Sri Lanka, a medical parasitologist. It's particularly aimed at Jim and Atiya. How is it like keeping the team, colleagues, and subordinates motivated in ever-changing circumstances, including the plans or programs you just made, and particularly during the pandemic where there is a lot of uncertainty around?
Jim's been waiting a while to say something, so I'm going to let Jim go first.
Right. Thanks, Atiya. Yeah, so I actually typed a response to this already. Basically, I'd like to just give some examples of this. So what has been very useful to me is starting with something you have in common with your team. So it's basically looking at the situation that you are in, how you have been all affected, and probably just taking time to take stock of everyone's experiences. I think, of course, everyone has their other styles, but I think it's important to really have this orientation, or just having this playing field that you are on the same page, basically. So I think that's starting with that. And basically, there is also the technique of being able to build emotional connection, but of course not in the sense like you are reaching supervisor relationships. It's more of really getting to know how a particular situation makes them feel, right? I think it's basically being emotionally intelligent. I think that's important, but equally important as well is really being mindful of the importance of the work. I mean, it's basically knowing how, for instance, how a particular project would help out a number of people if you were able to achieve it. So a very good example, I'd like to talk about it very briefly. We were, of course, the pandemic really made it difficult for us to continue our outreach programs in my college. So what we decided to do is to do a webinar series that was involving the whole college, and that was a difficult situation since our college in pre-pandemic times tends to really take things within themselves. It's like republics. Like we have the Republic of Epidemiology and the Republic of the Biostatistics. I mean, you have that kind of thing going on. So, and the challenge was to really bring them together towards a college level endeavor. And I think what made it work is to really
anchor the endeavor on something that we have in common. I mean, we all want to continue with our research projects. We all wanted to continue helping out other people, especially since we have lost that capacity already. So we started there, and we eventually were able to elicit so much participation that I think it was a success. I choose to believe it's a success. So yeah, so and it's basically going to that particular common ground. I think that's what made people motivated to continue on with the work we have.
Thank you, Jim.
Over to you,
Atiya, that was a very subtle use of leadership there as you delegated the first answer to Jim. Please go ahead.
Thanks, Peter. I'm going to make it short because I'm aware we're almost at time. I think just to say, so Jim's approach, I tried. It didn't work as well for me. So I was also convening a group of academics of different republics to deliver a research day for our university. And I midway through the process did realize that people were struggling. So I tried the approach of having a very frank conversation with everyone. Obviously, via Zoom, it's not most ideal to have that interpersonal discussion. And I realized that sometimes you can only meet people where they are. A lot of people were, I won't say in denial, but did not want to acknowledge the mental struggle that they were undertaking and felt that we should just continue. But there were other people who were able to talk and articulate. But in some ways, it made a difference, I think, to the people who were able to grapple with that from their own personal for their own personal selves, were able then to respond to that sort of leadership prompt to say, if you're struggling, let me know, and let us go down this journey together. For those which I didn't do, and I realize now in hindsight was something that I should have taken, was for the people who could not get to that point, I should have actually reached out on an individual basis and had more of a one-on-one discussion, because not everyone is comfortable discussing these dynamics in a group situation. So I think, as Jim says, it is again these subtle things around really meeting people where they are and understanding, what their personal way of dealing with workload or with pressure is. And it's very difficult when it's easy when it's your colleagues that quite familiar, but if it's people that you actually work with very sporadically, who may be senior to you, more experienced in many ways, it is a difficult task to undertake. But I'm glad that we are having, as I said in my presentation, these conversations are becoming normal, and I encourage you as a leader to continue having these discussions so that we normalize them even further. And yes, over back to you, Peter.
Okay. Thank you, Atiya. I think we've just got 3 minutes left, 3 or 4. So I'm going to go around the table very quickly for some last thoughts. I see, before we do that, Jean-Claude Kate from Cameroon has replied, thanks, Suraj, for the answer. Choose your battles wisely is the best phrase he gets from that. And I think that's a message that has come through in some of the other questions as well. And it also applies to organizations as well as individuals, I think. Biljana, you have been vocal for a while, so let's start with you. We'll move to Dipendra and Suraj, and then come back to Jim and Atiya for the final words.
So final words, final messages. Wow, sounds like very grand concept, but in fact, I would just go with a motivational quote, which made it seem like being in conflict with choose your battles wisely, but in fact, it is a complementary. And I would say stay open for new experiences, because we know from neuroscience domain that intelligence and creativity are based on not on the number of neurons, but on the number of connections we form with others. And you never know from which way you will gain some very important insight and very life-changing experience. And as I said, YPL was one of those unexpected, very, very pleasant surprises for me in my life. So by staying open for new experiences, I kind of felt better in my position. So I believe and I really hope, and now I kind of am positive because I know that you are selected, that you will be too satisfied with this program. All the best for 2021 cohort.
Thank you, Biljana. Dipendra, very quickly, we have just a minute or two left.
Thank you, Peter. Quickly going through, yes. The YPL platform has been, again, bringing all the kind of or styles of leadership into one platform where we can grow into the different kind of leadership into more cohesive or maybe more submissive, whatever the system we go on. But again, as a leader, it's very important that you incorporate different styles together and apply it in your context of your working environment where you are actually working on. So again, you may have your different personalities, but these kind of platforms were again added to Biljana notes. What we said, it's the connections, it's the informations about capacity building yourself and incorporating various kind of styles to your context, where we can again prove ourselves as a better individual, as a better leader in health, and better involvement in our engagements. This is something which I like to add. Thank you, Peter.
Thank you, Dipendra. Suraj? Anything to add, Suraj? You're muted. Maybe he's having trouble with connections. So let's move to Jim.
Yes.
Oh, Suraj, go ahead.
Yeah, sorry, I have trouble with connection, but yeah, I go Dr. Dipendra and Biljana and other colleagues that I think this YPL this might be a voluntary engaged career, and that's I can tell from my experience. So I mean, you spend time voluntarily, but you'll get paid off in different dollar forms in the future. Thank you.
Okay, thank you, Suraj. Jim, the time slots are getting shorter and shorter for each of you.
Yeah. Right, of course. So I think it's just as simple for me. So for me, leadership is not a one-size-fits-all journey. You have to really go through it so that you know what works for you. That's all. Thank you.
Wonderful. Atiya, last words.
Thank you. I think mine is a combination of something the friend has told me, which is you don't have to do everything and all the time. And words of a former mentor who said, well, whatever you do it well. And so these are my last words. And I just want to say on behalf of the committee, if any of you feel you would like to engage with us further, if you need any support, need a peer mentorship, if you would like to get involved, you are welcome to contact us through IAP and YPL, and we would welcome any more engagements with all of you. And we thank you for your participation today.
Okay, thank you, Atiya. And it just remains to me to give another example of leadership, if I may, and that's to give credit where credit is due. So thank you to all our speakers for this morning's session. Thank you to the questions. I think most of them came through from either former alumni YPL or the new cohort. So it was great to see you all here. Thank you, everybody. And we hope to see you next year in Berlin. Thank you all. Goodbye.
Thank you.
Everyone.